Welcome to the Tinnitus Relief Podcast. I'm Dr. Ben, and today I'm joined by Kat. Kat joins our podcast as a woman who is blind, who underwent significant tinnitus and is now experiencing relief and had a successful treatment. So, not only did she successfully reduce the tinnitus in her ears, but she did so completely blind without using her vision at all. Kat, I'd love to hear in your own words, what message do you have to share? What are we going to talk about today? And how are you doing?
Yeah, thank you. I'm doing well. So, today I just wanted to share my story of my time with Treble Health, how I came to seek services, and just the impact that tinnitus had on me and the way that it has improved my life, having my tinnitus symptoms improved, and just my kind of outlook in the way that I deal with it. Um, so I am totally blind. I've been blind since a very young age. Um, and so my hearing is not just my hearing. It's kind of doing the job of two senses for me. And it's very sensitive, so I use my hearing not just to hear, sounds around me, but it also helps me to navigate my environment. I can kind of hear where objects are, so I know, if I'm about to run into something. Um and it also, I can tell hear where someone's voice is coming from, kind of tell maybe how tall they are. Um, just a lot of cues that I think the typical person who has sight may not rely on their hearing for. And so I would say June of 2024, um, I started getting tinnitus symptoms that were louder and prolonged. I'd always kind of had some ear ringing when I would have migraines, or, maybe a cold or something, but it was always temporary and would go away. And this was definitely more sustained and was getting louder.
Hey guys, it's Dr. Ben. Quick word. We just launched two physical locations, two new tinnitus clinics with Treble Health. And it's all because of you, people like you who watched our videos and spread the word that there is help for tinnitus. I'm so excited to announce that right now, starting July 1st, you can see in-person audiologists from Treble Health. We're launching with San Francisco, California, and South Florida in location Weston, which is west of Fort Lauderdale. So if you live in the greater Northern California area, or if you live in Florida, I would highly encourage you to look at our website, treblehealth.com, and go under the locations. You can see the two clinics and what we offer. If you're someone who needs help for tinnitus, you're watching this because you need advice. You're looking for a solution. You need to identify what is the cause of this tinnitus. What can I do about it? Absolutely. We are here to help. If you or anyone you know could benefit from this, connect my team with them and come visit us in San Francisco or South Florida. I'll include the links below for you to go on our webpage and learn more about our doctors and our locations. Thank you so much. Now back to the video.
And it was really starting to interfere with my daily life. I couldn't It was making me disoriented. I couldn't hear people as well. I don't know, maybe a visual equivalent. Imagine like just having a lot of like floaters in your eye or flashes of light or something. Just very disruptive, very disorienting. And I kept going and seeing my primary care doctor, and I kept saying, "There's wax in my ear." And he's like, "No, there's no wax in your ear. You have the cleanest ears I've ever seen." And so finally he referred me to um, an ear, nose, and throat, and they had an audiologist who did a hearing test, and they're like, "Yeah, you might have a teeny bit of hearing loss, but like nothing concerning." And they referred me to a community speech and hearing clinic for tinnitus treatment, and the wait list was incredibly long. And I was just like, it was getting worse. It was getting louder. It was hard to sleep. It was hard to focus. It was hard to work. it was hard to exist. And um, so I started doing some research online and I came across Treble Health. I started listening to some of the podcasts, reading the testimonials and the information. And I was like, well, what do I have to lose? So I signed up for the free consultation and went from there.
Wow. Okay. And what did you do? I mean, what did you do to get better?
Yeah. So um I think the first big thing for me was just learning from um the Treble Health team. Most notably, I think this was when I started meeting with Suzanne, was that there's nothing wrong with my brain and this isn't damaging my brain. I just kind of had this thought that this is so disruptive. There must be something wrong and it must be getting worse. And I'm probably never going to recover. Like, I'm losing my hearing by having this sound in my ear. And that would send me into a panic. And then it would just get worse because I would notice it more. Um, and I would just keep catastrophizing. So I think that was probably one of the first, like, biggest things that really helped. Um, the sound therapy devices were also really helpful. Um, Having that little speaker on at night, um, with like the ocean wave sounds and the water sounds, which I found really worked for me, um, really helped me to sleep, and then having the sound maskers on during the day, especially when at work I'm on a lot of Zoom meetings. And so I have to wear headphones a lot. And the tinnitus would just get so much worse whenever I had headphones on. So being able to put the sound maskers in, have it set to, what Suzanne and I had figured out would be a good setting, and then put my headphones on over that and just have these calming chimes in my ears that I didn't even notice after a while. I didn't notice the chimes and then I didn't notice the ear ringing as well. It just kind of became part of my, I don't know. It just all kind of went into the background and I was able to actually focus on what I needed to focus on and get the auditory information that I needed. Um,
Wow.
and then
So
on
so
top,
your treatment was a combination of sound therapy devices, plus working with Dr. Suzanne, is that right?
yes, yes.
Wow. So how did you do this without vision? I mean, you're showing a very compelling story. Like, do you have support? Did someone help you with this, or are you just so superhuman that you can do all of this without vision?
Yeah. So um, I access my phone and my computer using a screen reader. So I guess that's the other thing. I have devices talking to me all the time. And so just another thing that I have to hear and pay attention to. Um, and so my smartphone has a screen reader that's built into it. I use an iPhone, so the screen reader is called VoiceOver. Um, and it's built in, so anyone can turn this on, anyone can use this. Um, and so when I first started with Treble Health, I met with Ramsey Poindexter, and she was talking about, these sound maskers use an app. And so she was really concerned, and I was concerned. Is this app going to work with VoiceOver, the screen reader? For things to work with screen readers, apps and websites and such have to be coded in a certain way, in order for the screen reader to identify the particular elements, in order for the user to interact with those elements. So it has to be done in a certain way. And
It didn't work.
yeah, so so Dr. Poindexter was like, I really want to make sure this works before you start the program. What can I do? And so she picked up her iPhone and I walked her through how to turn on voiceover and she opened the app and I told her what gestures to do and she's like, you know, this is kind of accessible. That's not good enough for me. I'm going to call the manufacturer. And I was just so impressed that it wasn't like she took my concerns seriously and was in that moment just like, you know what? We're going to test this out. We're going to see what we can do. Tell me what to do. And anyway, she did end up contacting the manufacturer. They sent me ones with physical buttons on them. We figured out, parts of the app that are accessible. So, kind of how to utilize that part of the app, but also the buttons on the sound maskers. And we kind of put things together to make it work. And then I worked more with Suzanne on fine tuning things. So, yeah, it was great, and even doing my setup, pairing things with Bluetooth, I worked with Crystal, and she was just great about walking me through things and being very patient and asking me what I needed. So, yeah, I gotta say, the team was just so great at taking my accessibility needs into account and making sure that I had the access that I needed and that they could do their part in making sure that happened.
Well, as one of the leaders of our team, and their boss, I'm very happy to hear that, and that is incredible because that's what we all want, right?
Yeah.
Tinnitus is so specific, so, um, you know, it's not a one size fits all approach, so we do need to go the extra mile to personalize a treatment, and it sounds like your treatment was very personalized, right?
Yes, absolutely.
Okay. So what advice would you have for someone listening who has tinnitus and is, in need of help? What worked for you? What might you recommend to someone else who is not doing so well right now?
Yeah. So I think, you have to decide what you're willing to invest to make things better. For me, this looks like a really good investment. And I just had gotten to that breaking point. And like I said, what did I have to lose? I think going through the program, there were times when I would make progress and then it would get worse. And that's really when I kind of leaned on the CBT skills, the cognitive behavioral therapy skills that I worked on with Suzanne, specifically related to the tinnitus. Um, but I think what really helped during the program and what still helps now is looking at this as a long-term thing. It might never go away completely. I don't know. Um, but for instance, I have some repetitive stress injuries in my wrists, and there was a time when I really couldn't do much, and I had to go to physical therapy for quite a while. And they are much better, but I still have to think about repetitive motions that I might be doing. I still have to stop and do stretches. I still have to listen to my body. Um, and I feel the same way with the tinnitus. It may get better and I just don't use the sound maskers. And I don't do things that really helped with it. And then suddenly, I had a very stressful week at work last week, and the tinnitus returned with a vengeance. It was so bad. And I was like, okay, like, let's not freak out. Let's use our skills. I need to start using the sound maskers more, kind of fallen off on that. And I went back to square one. Um, and, you know, it didn't take long to get back to where I was and really lowering um, the the disruption of the tinnitus and the way I experienced it.
Mm.
So yeah, it's it's not a cure, you know? And I don't know if this is something that can ever be cured. It is a treatment, and it's a really successful treatment, especially if you put the work into it and you stick with it and you just kind of turn these things into daily habits and work them into your routine.
I love to end our podcast with you sharing some words on, you know, what is your philosophy about how we can persevere through difficulties and live a normal fulfilling life, because I think for people with tinnitus it often feels like we can't, but you're also someone who is very vibrant and energetic and seems to be loving her life, and you don't have vision. So I'd just love to hear your philosophy or perspectives on how to persevere through difficult health conditions.
Yeah, I think what has always helped me and what helped me through this time was really making sure to identify the things that I enjoy doing and keep doing those things and keep focusing on them. Not even though a health condition such as tinnitus can feel like it's taking over your life, you can do things to prevent that from happening as you are going through treatment for it or experiencing it. So, um, I have a guide dog. A lot of people have pets or service animals, and just hanging out with her was really helpful, connecting with friends, even sharing what I was going through, but finding some humor in it, making sure to get out of the house so I wasn't just sitting alone, in my apartment listening to my ears ring. Um, and just really kind of pushing myself to to identify the things that I enjoy and to keep on doing them.
Kat, I love what you're sharing and the perspectives you bring. I just want to say thank you for sharing your story, because it inspires people that might right now be a little hopeless or not sure if they can get better. But to hear your story, you're giving tactical advice. You share what worked for you. And you're also, you can just tell listening to your voice, the energy behind it, that you're bringing hope, and you are in a much better place than you were when you first reached out to our Treble Health team for help for tinnitus treatment. So I'd like to just ask you, any final words for those listening who have tinnitus and might need some advice or some big sister energy.
Absolutely. I think my advice would be it may seem hopeless now, but nothing lasts forever. This is temporary. Things will get better. And it is scary to take that first step. It's easy to get kind of bogged down in that hopelessness and to think that it's never going to get better and it doesn't matter what you do. Maybe you've tried a lot of things before and they didn't work. So why would trying something else work? It can be scary, but it is worth taking that step. You are worth it, and if you go through Treble Health, their team has just been so supportive, and I think it's also important. It makes such a big difference to have that support in your journey to getting better as well. I can't emphasize how helpful it has been to just have that personal connection in that support in my treatment journey, and it makes a huge difference.
Kat, thank you so much. And for anyone listening, if you were inspired or want to say thank you on YouTube, go in the comments and type thank you. Kat, I really appreciate you. Great to meet you.
Great to meet you too. Thank you so much for this opportunity.